My name is Professor Lucille Blumberg. I'm the Deputy Director of the National Institute for Communicable Diseases in Johannesburg. This is a public health institute and is part of the National Health Laboratory Service. So I'd like to present on the Ebola virus. It's a very special virus that causes Ebola virus disease. It lives in bats, in remote forests in various parts of Africa, and causes outbreaks from time to time in countries in Central Africa, a few countries in East Africa, and more recently in West Africa. Very specific bats, these are very large bats found in remote forests in various parts of West, Central and East Africa, may harbour the Ebola virus. People may get infected when they go into these remote forests, and they're usually hunters who hunt bats, and who also may hunt various forest animals, forest antelope, gorillas for bushmeat. And gorillas and antelope may also be infected from bats with the virus. And when people butcher these bats or the antelope or the gorillas, they're exposed to the blood that is infected, and they in turn become infected. So what happens next is that people are infected with the virus. They may present in a remote hospital, the disease is not recognized, and they may die. And this is exactly what happened in a remote area of Guinea in December 2013. Probably a hunter who went into the forest got infected. Case was probably unnoticed. He might have been treated in a hospital by health workers who were not protected from exposure to blood or body fluids. His family members may have cared for him at home and in the same way were exposed. They in turn become infected. They may move to other areas of the country, and so the cycle of Ebola continues. So the outbreak was reported, was confirmed in March 2014, but probably started in December 2013. And by the time it was identified, it had spread throughout Guinea. Very mobile population who might have been exposed by caring for people at home or during funerals, and then they themselves move and set up the cycle. And to date, we have really a huge outbreak. It's really uncontrolled, more than 15,000 cases and more than 5,500 deaths, predominantly in Guinea, Sierra Leone, Liberia. These are countries with very porous borders where populations move between the countries and may become infected in the classical way, exposure to blood and body fluids of infected persons in the home setting or during preparation for burials. So these three countries, Sierra Leone, Guinea and Liberia, are in West Africa. They are really a great distance away from many other countries on the continent, and specifically South Africa, which is more than 6,000 kilometers away from the outbreak area. And in fact, these countries are probably closer to Europe. Many people see Africa as one big country, but there are many countries, particularly South Africa, which are really a great distance away from the outbreak area. There is an outbreak an Ebola outbreak that also happened in a very remote part of the DRC. This is a well-known area for outbreaks of Ebola. Outbreaks occur every 2 to 3 years. Population, the health authorities are very used to dealing with these outbreaks and respond very rapidly. And in fact, this outbreak has been declared over in November 2014. It's important to note that the specific bats that may harbour the Ebola virus are not found in South Africa or in the countries surrounding Africa. They are very specific bats that are found in remote tropical forests in specific countries in West, Central and a few countries in East Africa. So how is the virus transmitted? And I think this is important in understanding how people develop the disease. So you require direct contact with people who are ill with the Ebola virus. So you need to handle the blood, the body fluids, the vomitus, the diarrhea of these patients essentially with bare hands, and possibly during that process touch the skin of your nose, your eyes, or your mouth, which are quite easy to allow viruses to go through. So this really only happens in three settings. Healthcare workers, doctors and nurses who are treating patients who don't have even gloves, who may not recognize that this is a case of Ebola and may handle these body fluids. Many of the hospitals in these three countries are very, very under-resourced, and healthcare workers really don't have the bare minimum of materials to protect themselves. The second is in the home setting. A large number of Ebola patients were cared for by family members. They obviously were unprotected and were handling blood, body fluids, feces and vomitus of these patients, and in the process becoming infected. The third way is during the traditional burial practices, where the bodies are prepared for burial. It's a very, very important traditional practice in these families. And again, the people who are helping with this process are exposed to body fluids, particularly to feces. And it's an important way of them becoming infected. So it's really healthcare workers, it's family members, it's those helping with burial practices who are at risk and have become infected. And if you look at the people who've had Ebola virus disease, they fall into one of those categories. It's not people who are tourists, who have casual contact with people with Ebola. You really need that incredibly close contact. So what should one do to respond appropriately when one has an Ebola outbreak? And what has gone wrong in these three countries? Well, you really want to interrupt the chain of transmission. Ensure that persons with suspected Ebola are treated in specific treatment centres where the health workers are protected by wearing this very special clothing. The second is to ensure that there is a safe burial practice where those who are helping with the process are again protected. But often people don't want to go into a treatment centre, they're afraid. A number of the patients who've gone in have died, there is no specific treatment, and up to 60% of those who've been treated in treatment centres have unfortunately died. So people have chosen to be managed and cared for at home by family members, and that kind of just makes sure the train of transmission is not interrupted. And I think the traditional burial practices are very important in this community. And it's quite difficult to intervene there. It's important to get good messages out about how the virus is spread, but these are three countries that there was a lot of distrust, resources are very limited. These are countries that had many years of war and civil unrest, so it's not always easy to impose these control measures into this community. And yeah, I think Ebola has just added to the misery of what is happening and has happened in these three countries. And it's critically important that everything is done to bring this outbreak under control using well-tried and trusted methods that have worked elsewhere. But I think it's resources that are particularly an issue in these really very poor, under-resourced areas. So unfortunately, this outbreak did not come under control. There certainly was a need for more international support, an increase in resources, and the normal control measures to be supported by the international community. The countries themselves are not able to do this. There was also the concern about a risk of spread to other countries, and all of this resulted in the WHO, the World Health Organization, declaring Ebola a global emergency in the middle of August 2014. This allows a number of interventions to come into force in the countries, emergency measures to be applied, and highlights the need for the international community to bring their resources, their expertise, to assist these countries in bringing the outbreak under control. Included in the declaration of an international emergency is the need for increase in exit screening. So those who are leaving the affected countries have to go through a screening process to ensure that they're not ill and likely to spread the disease at their ports of disembarkation. and also provides other countries who may have some risk in the area with some guidelines about how to prevent introduction into their countries. I think what was very important in the WHO recommendations was that there was no international travel ban. So what are the risks of Ebola virus spreading to other countries outside of the 3 outbreak-affected areas? Well, it must be low, considering the way of transmission of this virus. So those who are infected, who will develop symptoms after the 10 to 21 days after being exposed, are not infectious. And casual contact with them, being in the same room, shaking their hands, is really not a risk. Unlike SARS, which was an important outbreak that affected a number of countries throughout the world, Ebola is actually quite difficult. The virus is quite difficult to transmit to other people. It is not airborne. There is no transmission on aeroplanes. You can't get it by simply being in the same room or even shaking hands with somebody. You really need that direct contact, handling feces, vomitus, and blood of infected patients. And this is not going to be the situation that affects tourists. It's really confined to health workers looking after patients or family members looking after patients, and both of this group without the necessary protection. So what is the progress, or how much spread has there been to date? Well, Nigeria experienced a small outbreak. A man from Liberia who was ill at the time did fly to Lagos. He did unfortunately require hospital admission very soon after arrival, and the disease was not very rapidly recognized, and a number of healthcare workers were exposed. And there was a small outbreak, a limited outbreak in Lagos and Port Harcourt. There was an incredible response from the country, and very rapidly, through contact tracing, through ensuring that healthcare workers were protected, and putting a number of measures in place, particularly in hospitals for early recognition of cases, the outbreak was brought under control and was declared over in October the 20th. There was one imported case, a student who went to Senegal. Again, the case was recognized reasonably quickly, and it did not spread beyond this one person. The DRC is an unrelated outbreak in a very remote area. This is the usual we see from time to time, particularly in the DRC every 2 to 3 years, remote parts of the forest. In the DRC, there was an outbreak. Again, a very intense response from the country, and this has also been declared over. More recently, there have been a few imported cases with some secondary transmission in Mali, and I think we'll have to see how things evolve there. But again, there has been a tremendous response, and hopefully, using the example of Nigeria, this will be contained. The United States has had a few health workers who were working in treatment centers in the outbreak affected areas, who probably did not use their protective clothing properly. I think there are sometimes things that happen. They scratch their noses or scratch their eyes with a bloody glove, usually when they're disrobing, and a few of them became infected. They've been successfully treated. There was also a man from Liberia who went to visit some relatives. He presented with an illness that wasn't initially recognized, and this resulted in secondary spread to a nurse in the hospital. There have been no further cases related to this incident since then. So I think this really shows that if you do everything right at the beginning, you can contain the spread of any further cases, and you don't have to end up with a situation of community transmission and many, many cases that we're seeing in the 3 outbreak-affected countries in West Africa. And then Spain, very similar to the United States. Somebody, a Spanish citizen, was brought there for treatment, and one of the nurses was exposed. Again, probably because of improper use of protective clothing. So I think it's important to note that despite The outbreak been going for 9 months. The majority of the cases remain within those 3 countries, and very few cases have been noted either in surrounding countries or those much further afield. And with early recognition, there has been prevention of spread into the community. So early recognition of a possible case and prevention of spread is absolutely critical and is an important message. Okay, so what about South Africa? Well, we are quite a long way from the 3 affected countries. We have no natural Ebola virus in this country or the countries around us. We don't have the bats. And we have a minister and a health department who've taken Ebola preparedness very, very seriously. And to date, we don't yet have a case, and let's hope it remains like that. So what is in place to prevent Ebola coming to South Africa? Well, there is some entry screening at our ports, including the airports, where there is temperature monitoring for all passengers. Obviously, this is limited and that it will only pick up fever if you happen to have a fever at that time. There are a number of hospitals that have been designated to manage any potential patients. There is a restriction on travel from the 3 Ebola affected countries, and anything other than essential travel for those from here going there is another restriction that's in place. We have no direct flights from the 3 affected countries. We've done a lot of doctor and nurse training. We have an excellent laboratory. We have a high security laboratory where the virus can be tested for if there are any suspected patients. It's the only one on the continent and has many years of experience. There is a high level of awareness, and because of that, lots of false alarms. But most of these are people who've traveled in Africa with fever and have turned out to be malaria, which is not totally unexpected. So I think an important message is that South Africa does not have Ebola. I think the risks of Ebola being introduced into this country are very low. The risks of an outbreak occurring, I think, would be extremely low, given the measures that are in place to recognize any potential case. I think the important thing is that tourists are not really at risk for Ebola, given the mode of transmission, where you have to actually handle blood and body fluids of patients to be infected. Not a virus that spreads that easily. So my advice is, if you're coming to Africa, you need to have some appropriate travel advice. You really need to take your malaria prevention seriously for travel in Africa. South Africa, we've had some very good control measures for malaria, and malaria is really restricted to the far north and the east of the country, including the Kruger National Park, but the risk would be medium. However, I think it's important to remember to take mosquito preventive measures and also to take medication to prevent malaria. It's a treacherous disease, but it is preventable if you do the right things. And it is the most important disease to know about if you're traveling in Africa. And there are a couple of websites that supply, I think, some very good and up-to-date information on some of the travel risks, including malaria in South Africa. So, yeah, I think Ebola is obviously a concern in West Africa. I think the risks in South Africa are really very low, and I think we have some fantastic attractions that tourists can really enjoy. So I look forward to welcoming you to South Africa. South Africa is not an Ebola risk for tourists.